cost of complications after robotic bariatric surgery. Why did I do that analysis? Actually, we know that an analysis of treatment costs are important, particularly when introducing new technologies. That's kind of the aim when you do something new. You want to do better healthcare. It seems obvious that complications are important cost drivers, but and they're important when you want to model a new technology out. But actually, there's not a lot of data how much complications actually cost in bariatric surgery. One example that we are discussing here, of course, in new technology is robotics, and we all know that it comes with a certain price tag between $1.6 and $2.5 million for the capital investment, service costs, instrument, and associates as taken from the investor's presentation from Intuitive. Now, when you think about this, you have your surgical costs, your intraoperative stuff, but you also have to consider your clinical outcomes. It's kind of a balance, and a balance might work if you have a significant reduction of length of stay. This is kind of the equation how it works, transitioning and open to a robotic procedure. But it might be a bit more tricky when you're transitioning from a lab to a robotic approach. You actually need to have an impact on the outcomes. So what did we do? In a single-center academic analysis, we took our data retrospectively and looked at all robotic bariatric procedures from 2014 to 15. We took the itemized and overall treatment costs from hospital administration, and we stratified the patients using the Clavian-Dindo classification. Just a quick reminder, Clavian-Dindo is the standard classification of complications, a grade 1, just in pre for complication not requiring treatment, grade 2, conservative treatment, grade 3, surgical endoscopical treatment, and 5 deaths for different things, organ failure, etc. Our cost analysis is the national standard for Switzerland that is used for reimbursement. It has been introduced in 2012. It is an itemized cost analysis. It really goes into the detail of our different cost posts, and it includes all treatment costs, including hospitalization and rehospitalizations up to 18 days. For our bariatric surgery, we perform majorly gastric bypasses, 100% robotics. We have a pretty standardized approach for same-day surgery, no routine ICU or IMC, no routine imaging, 1 lab analysis on post-op day 1, and I try to get patients out by day 3. We have a little bit more vague discharge criteria in Europe, and a big point here is willingness to go home, which is not always as readily available as it is in the US. Anyway, let's have a look at the results. We included close to 200 bariatric patients. You see primary gastric bypass were most of those procedures. And the demographics, pretty standard for what you see in Europe, younger patients, majorly female, BMI is moderate in comparison to the USA, and mostly relatively healthy individuals, some ASA 3 though as well. Let's have a look at the results. We had 136 patients without any complications, ending up at a cost of just under $20,000 US. A Clavian 1 complication, again, no treatment, just added a little bit of incremental costs, around $700. A Clavian 2, conservatively treated, plus $9,000, and reoperations, significant cost increase, over $32,000. Now, these are some of the itemized posts. Quite interesting to see that our anesthesia and ICU costs are similar for no complications, Clavian 1 and 2, but they show a steep increase for the Clavian 3 complications. And then for nursing and imaging, you have a more gradual increase of the costs. And then for Clavian 1 and 2s, we saw a very low impact on personal costs. And the length of stay was majorly impacted with a Clavian 2 or higher. We had a gradual cost increase with progression for Clavien for laboratory, and really exponential cost explosion for materials and drugs for the reoperation cases. In conclusion, we could show complications are very important cost drivers. The cost correlates in increments to the Clavien Dindo classifications. Already a conservatively treated complication has a significant impact with a 50% increment. And major complications just has an exponential effect on overall costs. So looking at that in the context of da Vinci surgery, if we take the costs that are on the intuitive website and assume that we're going to operate on 100 patients, we're going to have an increment of 70 to 350,000. If you imagine a 1% reduction in your complications, it's not enough to balance off those costs. So in other words, robotic surgery has to have a greater impact on complications to make the balance if you do not have other offsets. And that's pretty much the bottom line. Really, any new technology those days has to be like pretty good, like really have a fundamental impact on clinical outcomes, and they need to be cheap at the same time to actually be a good choice to move further. Thank you very much.